Neurological disorders are diseases of the brain, as well as spinal cord and the nerves. They are the leading cause of disability in Europe and North America. Unfortunately, they are only minimally susceptible to conventional treatment, and there is a strong need to develop new, more effective modes of treatment. In recent years, gene therapy has been introduced, and it is beginning to revolutionize the treatment of many genetic diseases, including the neurological ones.
Dr. Dulski came to our department just as a resident in neurology, and so the first year he spent just looking around and looking what we are doing. But after 1 year he was infected, I think, with this idea to make some science, to explore some topics. Our main scientific interest focused on neurodegenerative disorders, and he's especially interested in genetics, pathophysiology, biomarkers.
My primary research goal is to expand our understanding of genetics and clinical characteristics of parkinsonism and other neurodegenerative diseases, and to implement these findings into everyday clinical practice. I want to contribute to progress in genetics and pave the way toward gene therapy that would revolutionize the treatment of these diseases. It may stop, reverse some symptoms, or even cure the disease. My secondary research goal is to make a diagnosis in previously undiagnosed Polish families with hereditary, with familial disorders. In 2018, here in that room, I consulted a patient with involuntary movements. Similar symptoms were observed in the patient's father, who was already deceased at the time of consultation. However, the rest of the family had never shown similar symptoms. The most frequent cause of such presentation is Huntington's disease. However, it was already excluded before my consultation by a very reliable test. Because of that, I searched for another cause of the symptoms, but more and more tests were coming back negative. In the meantime, I learned a family secret. The father of the patient was found as an infant in a cradle. Thus, the pedigree of the patient was unknown. I also was provided with a videotape from a wedding ceremony 20 years earlier, and I could observe the symptoms of the patient's father. Despite the negative genetic testing for Huntington's disease, the symptoms, in my opinion, were typical of Huntington's disease. And I assumed the impossible, that there was some mistake in the laboratory, and I decided to repeat genetic testing for that disease. But it came back negative again. However, my strong suspicion of this disease in this family led to the hypothesis that there was some detection problem at the laboratory, that the method couldn't detect the mutated gene. A new set of primers were designed, and it detected the mutated allele, and the diagnosis of Huntington's disease was confirmed in this family. More than that, this refined method was used on all samples in the database, samples from the patients that were suspected of Huntington's disease but was tested negative, and this refined method made it possible to confirm Huntington's disease in 5 more families. And the findings from this study were published in the official journal of European Academy of Neurology, and I was proud to receive the Józef Babinski Award for this accomplishment. I wanted to study, to work, and then conduct my research at a top-ranked university, and of course to live in a friendly place. Medical University of Gdańsk met all of my requirements and expectations. Gdańsk is a beautiful city which is rapidly developing. It's my favorite city, and I recommend it.
I think that the role of mentor is to infect other, especially younger people, younger scientists, to spend time on science and scientific work.
I was lucky to find such a person, Professor Jarosław Sławek. I have learned a lot from him. He shaped me in many ways, and I appreciate his wisdom. And I don't just mean medical knowledge, but also experience, life lessons, etc.
I hope he will replace me someday, and I also have a hope that I will find many such good scientists, good doctors to build up the team, and we will continue our work in future.